Hello, I'm Kate Morse. I'm the Assistant Dean over Experiential Learning and Innovation in the College of Nursing and Health Professions at Drexel University. Experiencing education at CNHP, at Drexel University, is a core of what we do. And that means that it is a broad process, experiencing how we integrate our patients in the simulation lab, how we integrate experience into the classroom and into the clinical space. And we all bring different experiences to make that a richer process. So we have very deeply experienced clinical faculty who work with our students, both in the classroom, in the clinical space, and in the simulation space. So it's that richness of what our students bring, what faculty bring, what our patients in real life, what our patients in our simulation lab bring to make that a transformational educational process. In our simulations lab, we're unique in that we have the ability to provide a multitude of experiences. We have two very large skills-based labs where students get to immerse and learn the skills that are foundational to their practice. They then get to come here in our hospital wing and practice with our patients and apply those skills in context. And they get to do that in our standardized patient lab, both in the outpatient setting, in provider offices with actors portraying patients, and in our apartment so that they get to understand and interact in community spaces so that they get to see the entire spectrum of care. And the educational process builds and scaffolds from skills to context, to working with live patients, to their clinical practice with their expert clinical faculty. Simulation at the College of Nursing and Health Professions is unique in that we have a commitment to doing it in an evidence-based way. Simulation has a deep body of literature that supports how do we bring learners into the space so they feel comfortable to take risks and make mistakes and ask really good questions. So it is a stressful place for them to learn, but not so stressful that they can't engage in the learning. And it allows them to learn at the same emotional level that they are going to be in real live clinical practice. So we have a commitment to inviting and creating that space for learners and supporting our faculty to design cutting-edge scenarios that allow our students to be able to be practice-ready, which is really the focus of education when we think about nursing. Some of the unique work that we've done here at CNHP, I think about one of being Drexel Deliveries, which was born out of a need for all our learners, all our nursing students, to see and experience a normal birth. And as you can imagine, that's not something we can schedule in clinical practice. So what we do is we have a patient who is an actor who works with a prompt. So it's a hybrid simulation, part mannequin, like our gentleman who's here, and part real live person, and they deliver a baby over and over and over again. So our learners get to come in and interact with the patient and coach and teach and support, and also to see and experience a normal delivery with an expert coach in the room. And I think that's pretty unique because they get to interact and do more. Whereas in real life, if they don't get to see a delivery, they miss that experience, or they may sort of be back a little bit away from the patient because of the the urgency of that kind of activity. So this allows the learners to be fully immersed in it. And I think that's pretty unique. And it allows them, the feedback we've gotten them is it's so powerful for them to be able to see a delivery, to manage and talk and support with the patient, and then process it and debrief with expert debriefers and clinical faculty. The process of developing simulation scenarios is really a group process here, and we approach it in that the Simulation Center, including myself as expert simulation faculty, are fully fledged partners with our expert content faculty. So those are the faculty that are teaching the courses, and it's that marriage that helps to create really well-designed scenarios. And we're also supported by expert simulation operations specialists that help us figure out how can we make this as real as possible, how can we engage our learners, and that way we have a much greater chance of having transformational learning. So being practice ready as a nurse is really an important piece because of the environment that they're walking into. And we've always worked on the difference between what happens in education, what happens in practice, and trying to close that gap. The simulation space that's here at CNHP, I think, is uniquely positioned to be able to help them be practice ready. So for example, here in our hospital wing, they can care for 4 or 5 patients and practice that prioritization and that stress of being called from room to room, whereas oftentimes in the hospital they can't practice that skill just because of the environment. So I think that here at CNHP, we have a commitment through simulation, through the teaching modalities, to really improve and have them be on the edge of being ready to be practice ready. And that's a challenge for all of us, but I think that our space and our process gets us a little closer. I think that the future of simulation is about being heavily embedded in the curriculum and meeting learners where they are. So that means that we are using augmented reality, we're using virtual reality, we're getting them to practice on their phones in their own time and sort of, have education on the go so that when they come here and meet their patients in the simulation space, they've had this scaffolded practice and they're much more ready to be fully engaged. So I think it's about thinking, how do our learners learn? How have our learners changed? And meeting them where they are. Because it's not the same environment as it was 10 years ago. I think the value of a Drexel education is that the whole is bigger than the parts. So we have the opportunity here to develop interprofessional education in our new building. Our clinical partners with College of Medicine are right down the hall. We have clinical partners within our own college. That is a unique feature that allows us to have our graduates have had experience working in different teams. Additionally, we have this beautiful simulation center that allows scaffolding of skills and practice of skills with good feedback, I think, which enables our graduates to develop and graduate with that skill of receiving feedback and being closer to being practice ready. And I think that makes them very attractive to our clinical partners as new graduates. Ensuring success of students in CNHP and particularly in the simulation lab depends on how you measure it, because here we view mistakes as learning opportunities. So we actually get very excited when we see learners make mistakes or go one way and we think, perhaps there was another way to address that patient or that patient problem, because that allows us to get into their thinking and really process what was going on, and that allows them to then take that to the next time they see a real patient who has that problem. So I see success as building students' resilience in being able to be this reflective practitioner, ask questions, feel comfortable with the speaking up skill, which is a hard skill to learn, and be able to be a patient advocate when they leave our care and move into real life practice. So oftentimes we think about what is it that makes simulation successful, and the students see the front end. They come in, they see all the beeps and whistles, they see their patient, everything set up, and really the magic that it doesn't happen without is all the work that goes on behind. So those are our simulation operations specialists that set all up the equipment, making sure we moulage so that things appear to be real, which is very engaging for learners. And without them, all this doesn't work. And they are the ones who understand how our mannequins work. They maintain our mannequins, and they really help faculty with design and solving design problems so that things make sense to learners. Because if things don't make sense to learners, it's hard for them to engage. And that's one of our jobs here in the Simulation Center is to draw in our learners, because engagement means we have a much greater chance of learning. I think one of the great strengths that we have here at CNHP is our faculty. We have such a breadth of clinical experience. That allows the learners to have multiple touch points with faculty who have deep clinical experience. And the other piece that I think is so important is the fact that faculty are so engaged in the students' success. They care about the students, they care about them doing well. I see them coaching, I see them meeting with students, helping them get over struggles, because school is hard, and it should be for all of us, because we should be graduating different than when we came in, and that requires us to change, and change is uncomfortable. So two things that stand out to me is the depth and breadth of our clinical experience, which is so meaningful to learners, and the fact that faculty are invested. They care about the students doing well, they care about them learning, and that I see translated in the relationships that they build.